You can imagine that having a child diagnosed with cancer can be heartbreaking and overwhelming. Now there is a new way to treat children with cancer using proton therapy. Paige visited the Texas Center for Proton Therapy in Irving to find out why doctors are choosing this for younger patients.
Welcome to the Texas Center for Proton Therapy, a unique facility specifically designed to address the needs of children undergoing cancer treatment. I'm excited to introduce you to Dr. Victor Mangona to tell us more. Good morning to you.
Good morning, thank you for having me.
Let's talk a little bit about proton therapy. What is proton therapy?
Proton therapy is a type of radiation therapy that we use for treating cancer. It requires a particle accelerator, a cyclotron, which takes hydrogen atoms and accelerates them to nearly the speed of light and sends them down a beam path to deliver energy to a patient's tumor area.
Why is it a particularly good option for children undergoing cancer treatment?
So children are growing and developing all of their normal tissues. And when we have to do radiation therapy for treatment of a tumor, we want the treatment to go only where it needs to go and minimize any additional radiation exposure to those developing normal tissues. And proton radiation therapy allows us to keep those normal tissues to the lowest possible amount of radiation exposure that we can do.
All right, so what types of cancer have responded well to proton therapy?
So we use proton therapy for treatment of any type of tumor that would receive radiation as part of the treatment paradigm. For children in particular, we often are treating brain tumors, but also treat tumors in the chest, abdomen, or pelvis. But anytime we're utilizing protons, we're utilizing it to help minimize that extra unnecessary radiation. So it can be used really for any type of cancer or part of the body, as long as it helps provide an advantage in comparison to alternative forms of radiation.
Take me through a child's journey when they come to the Texas Center for Proton Therapy.
So our facility was designed to incorporate the treatment of children's cancer with radiation. So we have a child's play area when you come into the front entrance. We actually also have an anesthesia bay where the children wake up from anesthesia. And so when a child comes the first time, they'll come to our clinic. I'll see them for a consultation and we'll discuss the treatment. Then they will come back for what we call a simulation session, which is when we do all of our treatment planning. When they come back after that, we will then begin the treatment. It'll be a Monday through Friday, once a day, outpatient treatment for a number of weeks, depending what kind of tumor we're treating. If they're young enough that they are unable to lie down for the treatment awake, they have daily anesthesia, and that's when we utilize our services from our pediatric anesthesiologists and our sunrise room. We also have a full-time child life specialist whose job is to help the children with the whole process of going through radiation therapy.
So what are the steps for making an appointment?
So often patients already have a hematologist oncologist who can refer them to us directly. However, you do not need a referral to be seen here. They can go directly to our website or call us at our phone number.
Fantastic. Thank you so much for being on the front lines of treating such an important disease and helping children who are struggling with cancer.
Thank you so much for having me.
And to find out if proton therapy is right for your child, schedule a consultation with one of the experts. You can call 469-513-5500 or go to texascenterforprotontherapy.com for more information.